Yeah, hi friends. People often ask me whether open or whether laparoscopic surgery is good for inguinal hernias. I am Dr. Jiten Chowdhry from Mumbai. So, laparoscopic surgery has certainly many advantages over the open surgery. Through small holes, we enter the abdomen. We normally create an extraperitoneal space, and in that space, we repair the hernia. And in laparoscopic surgery, we can put a bigger mesh than as compared to the open surgery. Mesh, as you know, is the supportive framework for the hernias. And we can cover the entire weak area, which we call it as an area of myofractal orifice, through the small holes. The biggest advantage is in the bilateral inguinal hernias, because in those hernias, through the same holes, we can put two large mesh, which is not possible for the open hernia surgery. Since cuts are small, the recovery is fast, pain is less, and patient can be discharged earlier than the open hernia surgery. Yes, of course, if the patient is unfit for general anesthesia, we offer those patients open hernia surgery, which can be done under spinal anesthesia or local anesthesia. So to conclude, the standard of care is laparoscopic hernia surgery rather than the open hernia surgery, unless until the patient is unfit for general anesthesia. Thank you. For any queries or any help, feel free to contact us.